Gender-based violence. What acts or situations constitute the presence of the risk? Gender-based violence, or GBV, includes any harmful act carried out against someone based on socially ascribed gender differences between males and females. These acts cause physical, sexual, or psychological harm and may involve threats, coercion, or loss of freedom, both in public and in private. GBV disproportionately affects women and girls due to systemic gender inequality and overlapping forms of discrimination, such as racism, ableism, or nationalism. These intersecting barriers not only increase risk, but also hinder access to safety and assistance. Some forms of GBV include intimate partner violence, other forms of domestic violence, forced and/or coerced prostitution, child and/or forced marriage, female genital mutilation, female infanticide, honor killings, trafficking for sexual exploitation, denial of resources, and/or forced domestic labor. Importantly, GBV can also affect men and boys, particularly in armed conflict or detention settings, where sexual violence may be used as a weapon to humiliate or punish. In any humanitarian crisis, GBV becomes more likely, especially when law, services, and social structures are disrupted. What factors must be identified for monitoring? Monitoring GBV risk means identifying the conditions that allow it to increase, such as weakened protection systems, harmful social or legal norms, displacement, scarcity of resources, and loss of community safety mechanisms. Crises often disrupt healthcare, community and social support networks, and justice systems, limiting access to services like sexual and reproductive healthcare or legal support. When support systems break down, violence increases, and perpetrators are rarely held accountable. GBV is globally underreported. Survivors may fear stigma, retaliation, or simply lack safe places to seek help. That's why we must assume GBV is happening and design responses accordingly, regardless of whether cases are reported. The presence of other protection risks, such as displacement or family separation, often signals heightened GBV risk. What information and data can illustrate the presence of the risk? Because GBV is widely underreported, the absence of data doesn't mean the absence of violence. Data collection must always prioritize survivor safety. Instead of seeking exact numbers, humanitarian actors should use a range of sources to identify risks, including expert observation, past crisis data, legal and cultural analysis, and reports from other sectors. Collaboration with the GBV area and collaboration with specialized actors is essential to interpret data responsibly and act on it. In every setting, GBV must be treated as a life-threatening protection risk. Prevention, response, and survivor-centered care must be integrated from the start.